All right, welcome back. Today I want to talk about family therapy. Ben, what is family therapy and why is it so important to you personally and to what we do here at Sylvia Brafman?
So, family therapy is a form of counseling and therapy and psychology that involves one or more family members that focus on the family system, and the roles that the family plays within that system. It can be husband and wife, mother, father, the siblings. And of course, in the 21st century, it could be, step parents and step kids and grandparents and whoever really is involved in the system. That's family therapy.
We always say that family therapy or the family component of Sylvia Brafman is a non-negotiable for us. We're not the kind of place where you drop your loved one off and you say, see ya in 30 days,
Right.
90 days, however long it is.
Right.
It's sort of the crown jewel of what we do here, and it precedes my involvement in the behavioral health world. Obviously, it's driven by your 25 plus years of doing this.
Yeah.
Why is it that you've decided to make the family component such a critical part of what we do here? It's sort of like your bread and butter.
100% of patients that we deal with here at Sylvia Brafman, and honestly that everybody deals with in treatment, have families. 100%. And families, no matter what, you're estranged from them, you're enmeshed with them, you hate them, you love them, they are going to play a role in your treatment in getting better somehow, some way. And maybe that's a belief system that you have, maybe it's a cultural thing that you have, and maybe it's direct involvement. And it even includes family members that have passed away. Not making right with your parents, before they passed away, leads to trauma and depression and anxiety and all of that. Abuse that goes on, miscommunication, siblings who don't talk to each other. There's so many things to it. Plus, the type of communication that families have and the illnesses that they get passed down from generation to generation until you make a stand and until you change your behavior. I often like to use the example of going back to a family reunion and you live 1,500 miles away, and you're in your mind and saying, I'm not gonna talk to this person. I'm gonna talk to this person. This person's gonna fight. This that. I'm gonna be me. And then 2 minutes into the family reunion, you revert back to being the youngest child in a family of four, and you're throwing f-bombs and raging out, and you don't even know what happened, and that's because you never really truly addressed the issues that you had with your family. So it is a non-negotiable. It has to happen, and the other reason is this. You've heard me say this. Sometimes the patient is not the problem. It's the family that's the problem, and that needs to be worked on in family.
So looking at it a little bit more practically, when we say the family component is a critical piece of SB, we mean the individual family sessions that occur with the primary therapist. We mean overall the level of communication between the various providers here and the families.
Yeah.
But we largely mean family night, which is your
Right.
baby.
Right.
I myself am a byproduct of family night. I think I've told you this story that when I was considering moving down to Florida and opening Sylvia Brafman with you, I told my mom what I was thinking of doing. She immediately said, don't do that. You've got this great job on Wall Street. You're 30 minutes away from me in New York City. And then I told her who it was with, you obviously,
Yeah.
and she immediately forwarded emails between the two of you from like 2 or 3 years after I left what was, a different treatment center.
Sure.
And that meant a lot to her because obviously it meant that your heart was in the right place.
Yeah.
But but clinically she remembered that you were exceptional, way beyond any of the 7 places that I had been, until I finally got it at 24 years old. So I do think that your direct involvement in family night, maybe in a roundabout way, contributed to us being together here and starting Sylvia Brafman.
Right.
But just talk to me about what you're trying to accomplish in family night. Why do you have this death grip on it where you won't let anybody else touch it?
Yeah. So first off, I want to say this, and you've shared pretty openly about your journey and your family involvement. It is my belief. I'm sure your mom would agree with me that if Karen and the gang didn't get it, you wouldn't be here, and to me that rings very true, and that's hugely why I do what I do. But the reason that I hang on to the family night and all the dynamics with that is it's complicated. You've got issues that have issues, and it's not just traditional therapy. It's a different type of thinking. You are educating people that have never been educated. They think they know, but they don't. You are talking to very egocentric people that think they know what their role is, and they don't. You're simplifying things that are very complicated. You're dealing with mental health issues that are impacting the family system, or addiction, which is like introducing cancer into the family system. So you're dealing with that, and you're organizing a plan into how to succeed. How can a family get back together enough where they feel that they're heading in the right direction, they feel like a family again? And so with all of that being said, I do that in family night. I do that through educational purposes. Spend a lot of time talking about codependency and enabling. We talk a lot about the roles in the family. We talk a lot about perception, and we talk a lot about mental illness and addiction and how that impacts the family. And we also talk about all the other relatable things that impact family: age, culture, your job, life circumstances, anything and everything. And the families leave there where they feel more organized in their thought process. They have redefined what success looks like. They have accepted things more than they did before, that maybe I am part of the problem, or maybe my child or spouse is doing better than I thought. Maybe I'm doing better than I thought. And they also leave there with tools so that they never have to go back to the way that it was. And so all of that, it's a special night for me. I enjoy it. I love to see the patients overcome their fears. Some of them are talking to their families for the first time ever in a productive way, and it's extremely emotional.
Yeah, thank you.